More people aim to live healthy lives free from chronic illness and disabilities until the end. You'll be promised hundreds of therapies, protocols, and longevity hacks that are completely useless. But there's something that's quite accessible, has a lot of evidence, and will improve your life from the very first session. It's the sauna. I'm Dr. Borja Bandera, and in today's video, I'm bringing you all the evidence about the longevity benefits of the sauna. At the end, I'll share my recommendation and the protocol to follow, so it's clear for you. Bathing in heat, with the purpose of purifying the body and healing the spirit, is an ancient practice present in many cultures. Civilizations across time and continents agreed. Increasing body temperature benefits physical and spiritual health. And without clinical trials, they weren't wrong. The sauna was born in Finland, a country that has 3 million saunas and 5 million inhabitants. As a curiosity, in the past women gave birth there and the dead were laid out. Why? Because it was considered the most sterile room in the house. That's why they consider it a sacred space, practically related to birth, death, conflict resolution, and cleansing of the body. But heat therapy is used outside Finland too. There are and have been many other heat rituals, such as the banya in Russia, the Arab hammam, the Roman baths, or the temazcal in Mesoamerica. First, it's important to clearly define a sauna, which comes from Finnish and simply means a bath or sweating room. This involves briefly exposing the body to high temperatures, ranging from 45 to 100 degrees Celsius, depending on the type. Doing this causes mild hyperthermia, raising your body temperature and triggering neuroendocrine, cardiovascular, and cytoprotective responses. Why? Well, to be prepared for the next stimulus. Is that hyperthermia an aggression, just like exercise? We're talking about, that it's a hormetic stressor. The key to longevity is that this response has a lot of evidence of being beneficial and making your health more robust. Also, today you're going to learn exactly how. Why would you believe me if I told you that doing sauna daily is on par with exercising daily? In terms of prevention, I'm going to explain it to you. The foundational study on sauna benefits is Kuopio Ischemic Heart Disease, a prospective cohort study. City of Kuopio in Finland, which has followed thousands of middle-aged men since the 1980s, evaluating their different risk factors. The main conclusions of the study regarding sauna use are that doing it more than 4 times a week, that is almost daily or daily, it was linked to a 40% lower risk of death from any cause compared to doing it just once. And when we evaluate which diseases the sauna protects us from the most, there are clearly 2 winners: cardiovascular disease and, as you might imagine, neurodegenerative disease. In this study, daily sauna users had a 65% lower risk of Alzheimer's than those who used it once. This magnitude of benefit is only surpassed, and pay attention, by stopping being obese or quitting smoking. It's similar to the reduction seen when moving from being sedentary to starting exercise. Yes, doing sauna daily is comparable to doing some aerobic exercise. That's how powerful sauna is when done regularly. But of course, you don't change. You don't get convinced until you understand. That's why now you're going to understand the real benefit of sauna. First, sauna is a mimetic exercise. I always say no pill can match all the benefits of physical exercise. But if anything comes close to aerobic exercise, it's the sauna. In fact, many professionals suggest sauna as an alternative to aerobic exercise. For those unable to do it because of physical limits or illness, and for the many unwilling to do it, this would be very useful. Why is it so good for the cardiovascular system? First, it improves vascular compliance. What does that mean? This means making your arteries more elastic and less stiff, so they can expand and contract properly with each heartbeat. They also lower resting blood pressure, both systolic and diastolic, which is a major cardiovascular risk factor. It improves endothelial function. As you know, the vessel lining isn't inert. Its health controls how much atheromatous plaque enters. It also optimizes autonomic function. It balances the sympathetic, fight or flight, and parasympathetic, repair and rest arms of your autonomic nervous system, which is skewed toward the sympathetic side, because we're all extremely stressed. Second point, release of dynorphins. Look, dynorphins, not endorphins, are a type of endogenous opioid, but they're associated with negative or dysphoric emotional states. They really make you feel bad for a moment when they bind to your kappa opioid receptors. Why? Well, so you get out of hell. Out of the sauna? Nobody wants to be at 100 degrees for too long, but there's a hidden benefit afterward. They sensitize your mu opioid receptors to beta endorphins. That's why, when you leave the sauna, you're more able to feel pleasure and relief. It's that sensation of floating out of the sauna. I feel great, such intense well-being, thanks to the dynorphins. The sauna aids muscle recovery. Attention, athletes. Heat sends more blood to the skin and muscles, increasing blood flow to contractile tissue and washing metabolites from the muscle. Along with supplying oxygen and nutrients, this also aids recovery after intense effort. Why wouldn't it? Let's mention heat shock proteins. Heat shock proteins, GH. Two proteins present in all cells, which specifically repair other damaged or misfolded proteins. That is, they help preserve the tertiary structure of proteins, but they also prevent the accumulation of plaques and protein aggregates inside your cells. They are established as a key natural defense in your cells and are thought to protect against neurodegenerative diseases like Alzheimer's, Parkinson's, and Huntington's. Additionally, heat shock proteins, 70 expression appears to protect muscle from atrophy, making it a potential ally against sarcopenia. And yes, they increase when body temperature reaches 38-39 degrees. Although you might be thinking about fever or the sauna, intense exercise is the most powerful physiological inducer of these proteins. The sauna stimulates your immune system. The body reacts similarly to infection and sauna, boosting white blood cell production and antiviral response. It also increases heavy metal excretion. How? Through sweat, mainly aluminum, cadmium, cobalt, and lead, which are eliminated more through sweat than through urine. Few methods exist to boost heavy metal excretion, making this one especially valuable. Now let's discuss the practical side. What sauna types are available? We could say there are three. We have the infrared sauna, which emits thermal radiation that directly heats your body. It operates at a lower temperature than traditional ones, between 45 and 60 degrees, and typically focuses more on muscle recovery with less cardiovascular stress. Then there's the traditional Finnish sauna. They heat the air to 70 to 100 degrees C, typically 80 to 90 degrees C, and the hot air warms your body with low humidity, around 10-20%. Very different from the Turkish bath or the so-called wet sauna, where we have relative humidity above 50% and lower temperatures. You sweat less and get fewer benefits than a traditional sauna. I didn't even include this one. Finally, there's the hybrid sauna, combining infrared and traditional elements, and they're growing in popularity. But what protocol and type of sauna do I recommend and use personally? Well, look, I recommend the traditional Finnish sauna over the steam ones and even the infrared ones. Although at home I have an infrared one, because it was small and it was the only one that fit in my house. As for the duration, between 15 to 20 minutes per session is what you should aim for. Start with 5 minutes and gradually increase, or do shorter sessions alternating with cold for contrast therapy. As I said, keep the temperature between 80 and 90 degrees. Don't go above 90 unless you're an expert with years of experience. And as for frequency, well, you can start with 3 times a week up to a daily frequency. Why? Because the benefit is much greater than doing it just once a week. In the study, we saw that sauna therapy has a high ceiling. Generally, more sauna means more benefit. No dangerous weekly time limit has been identified. Clearly, there must be one, but it's not described. Compared to weekly sessions, daily sauna use lowers all-cause mortality by 39%. If you want a video focused on the contrast method, alternating cold and heat, let me know in the comments. If you want to know more and you're a professional, I recommend you read this completely open access, free review. I'll let you go now. Thanks for watching. See you next video. Let's keep empowering.